I think Dr. Lewke-Bogle has contributed a tremendous amount in the doctor field, but also on the community side. She's very much involved, or has been very much involved, both her and Bob, in the community life.
And they're doing lots of mountain biking and on trails.
With Dr. Lewke-Bogle, it's not just being the doctor here in town, it's her presence in and around the community.
Hi Kelsey, how are you doing?
Hi, I'm okay, a little nervous.
Okay,
How are you?
I'm good.
My mom has made a huge contribution to the community of Milk River. She's been there for 40 years. She is not just a part of the medical community, but she's part of the social community. A big part of what makes her different as a doctor is the fact that she gets to know her patients and know the families and take that time. So that impact is hard to measure or quantify, but you see it in people's responses to her.
In every action that she does, you can tell that she cares. It's not just a job.
What's the blood pressure? What are the vital signs?
The blood pressure is 156/90.
Okay.
His blood sugar is 5.6.
Which is good, yeah. I see myself as having multiple roles. I'm a mother, a wife, a doctor, a community member. I love photography, I love to garden. So there are many facets to my life. And it's important for you to understand what we're doing before we do it. And then we'll test to make sure that you're truly frozen before you've had. Have you had any procedures done in the past? No. Okay. One part of my life that has been a passion is the medical profession. It was January of 1976 when I came to Milk River. And what drew me to the community was a classmate of mine was here at the time, who said, well, why didn't you come? And again, it's one of those stories. I said I was coming for 6 months because I'd spent 3 years in Botswana. I went overseas with CUSO, the Canadian University Service overseas. I went to Botswana, worked there for 72 to 74, and then extended another year with the hospital directly. And I had really enjoyed the surgical side of things, so I wanted to be a GP surgeon. So I said, well, working in a third world country, I didn't have much money under my belt, so I'll come here, earn a little money, and then I was planning to go to Britain and do some surgical training. In the meantime, I met my husband, and so now you know the rest of the story. If you could start browning the meat, and I'll get the onions. Bob, are you ready for some?
I'm ready. This was my mother's frying pan. Well, we've been married almost 38 years. We've lived in Edmonton. We've lived here on the farm. We raised 4 children, 3 of whom are now married. We have 5 wonderful grandchildren. Life has really been good.
Hey, we're here for the interview today.
Oh, that's awesome. Yeah, great. And I see you didn't bring your grandchildren. That's
Hey,
really
hey,
thoughtful.
no, that's the children. Where's your
And-
little princess?
Oh, yeah.
Dr. Lewke-Bogle is my mom. I'm the eldest of 4 children, and yeah, growing up with her, it was quite a different experience than maybe a typical childhood would be, but you know, she's really been such a great role model. And now myself, I'm a working mom with 2 boys, and I can really appreciate kind of the struggles and balances that she had to go through raising 4 kids in a small town, being a full-time doctor.
I do want you to just pay attention to your sinus condition. So there is a little bit of expansion in the bone up in that space. The wonderful news is very, very treatable for what we have to do. It's funny because they always wanted to instill a strong work ethic within us, and I believe that my mom was the most patient employer in the world. We were actually hired in her clinic to help with some of the filing, but we couldn't get to the top of the filing cabinet. We weren't tall enough, so we would have to file the files that were on the lower end. So and we had lots of support staff with my mom that helped with us a lot, but creating that strong work ethic and that respect for the medical profession was something that was critical growing up, and that's something that I'll always remember, and I look forward to my family being able to have a piece of that as well too.
She loves what she does. She's really, truly passionate about her role, and That's why she has continued to put so much effort into it and so much dedication.
Well, and I remember, you know, vacations and stuff with Christmas, because she would have to work, and she still does have to work either Christmas or New Year's. And so, you know, times when other kids that you go to school with have like a given off and they're off with their families at cabins in Whitefish, like we didn't have that. It wasn't even an option because everything was kind of truncated.
She really taught me a lot about caring for people and just taking time and being patient. We could ask her a million questions and she would answer very patiently each question time after time. And I strive to be like that.
It was about 5 years ago. We were really pleased. Liesl was at that time semi-retired. So she was doing locums around the province, but she could pick and choose when she wanted to work and where. And we were able to fit in time with our grandchildren, holiday time, and we really felt that we were experiencing the lifestyle we wanted for that stage in our lives. Then, as I said 5 years ago, that all changed.
I retired the first time in 2005 because I wanted to have some flexibility in my life and so that we could do some traveling, and as we're both aging, you know, wanted to travel while we still could enjoy good health. So I came out of retirement when 2 physicians left at the end of 2009, and then I retired after the other physician was established. He unfortunately decided that it was too much and he left, and so then I came out of retirement the second time because the need was still there and we were still busy trying to recruit another physician.
When Dr. Lewke-Bogle came out of retirement, it was literally to save the medical services here in Milk River, to make sure that the people here were covered medically. She had to, or we were in a world of hurt. We would not have kept the hospital. That would have closed.
So I think she has been instrumental in keeping Milk River going these past few years, while she's single-handedly been, you know, towing the load of quite a few patients.
Hi Craig, how are you today?
All right.
Good, things are happening all right?
Once she retired, we couldn't get any doctors. A doctor would come in for a month or two and then leave, and basically she kept the hospital open.
Just so if you lean forward, yeah. When my children saw that I was determined to go back, my children said, "But Mom, you've done your contribution. You're at an age where you should retire. You should be able to spend time with your grandchildren." And they said, after watching me, they said, "We realize it's your passion. We can't take that away from you." Okay, all right, take care. Yeah. Say hello, Julie.
Yeah.
Thanks.
Really, it's a fantastic moment to be able to say, we can take the sign down. We've got 2 doctors here now, and we're going to try to recruit a 3rd. I can look forward to full retirement. I can spend time with my grandchildren and children and do more traveling. But this is a spectacular moment. And the wind continues to blow in southern Alberta. There you go. Yeah, that's good. Yeah. Or how's that? Are you ready? Jump for joy. Jump for joy.
Oh, receiving this award for her has got to be the pinnacle of her career. She has, she's never asked for any, you know, accolades. Yeah, that's just not the type of person she is. But being recognized for, you know, her tireless work, I think is just really, really awesome, because she has spent hours, days, years being the sole physician, on call 24/7, raising a family, and, you know, dedicating her life to medicine.
I think she deserves it 100%. I think she kept this place running for some time on her own. She part of the community, part of Milk River Hospital and Clinic. So, and I think she put in the hours and threw in her weight in every possible way that she could. So I think it's well deserved, and I think there's no way to argue around it whether she deserves it or not. I think it's well deserved.
I'm exceptionally proud for my mom. She's an amazing lady who's devoted countless hours in family and personal sacrifice to support the community. And this is a really, really nice acknowledgement for her. She would do it regardless. She doesn't do this for praise, but I think a public acknowledgement from both her peers and her patients is very well deserved, and it's fantastic, so I'm proud of her.
She's just one of those people who's so selfless and so giving, so that to take the time and to recognize that is really great. But one thing that I think should also be noted is that there's a whole team of people behind her. She kind of gets the limelight, but there's the doctor recruitment committee, there's her office staff, there's the nurses in the hospital, and they're equally as important in this picture because it's a real collective effort that they've kept the hospital going and made such a difference. So I do think this award kind of goes to the town of Milk River for such an amazing group effort and healthcare system.
I'm thankful for the community for the support they've given us. All that work would not have been possible without the use of what are called locums, the doctors who fill in on weekends and week evenings.
I know our children have the same feelings that I do towards their mother, my wife, in receiving this prestigious honor. She's worked very, very hard and very diligent, and with one sole purpose, and that was to serve the community, to ensure that we would not lose our emergency department. And we've achieved that goal.
Thanks to the rest of the committee for all the hard work that you have done. I feel very honored to receive this award. I know that there are many worthy recipients or eligible recipients throughout the province. I know that rural Alberta is well served by the physicians that are here. There is a need to recognize the people who do serve rural Alberta, and I'm very honored to have received this award.
I don't know if words can express gratitude for somebody that had worked very hard, went into retirement, started to enjoy retirement, and came out because, in a way, she had to, but yet she didn't have to. So the gratitude is what I would like to express to her and to her family, because she gave up a lot. Her family gave up a lot when she came back to work. And so the gratitude goes both ways. It goes to Dr. Lewke-Bogle and it goes to the family. And I think that's really important, that everybody is thanked for what she has done.
I'd really like to thank Dr. Lewke for everything she's done for the community and the hospital, and training the new staff and just the patients. She's just, I'd really like to thank her.
Thanks for thinking of us and coming back all the time, Liesl. It's you've gone over and above.
I'd like to thank her from the bottom of my heart very much for being part of our community, participating and being a caregiver in our community. Very much appreciated, and I can say that on behalf of all of our community.
Thank you.